Doesn't matter, whatever is comfortable for your body. I am kind of lazy, and I like to bend their knee and bring the foot to a height that's comfortable for me. The taller they are, the less I have to pick their foot up to get there. But, you know, I don't want to be really high, and I just can't stand being hunched over. So I'll pick their foot up and bring it to me. Realistically, everything we did on the hand is fair game on the foot. So there's not a carpal tunnel, but right here on the medial aspect is the tarsal tunnel. It serves the same purpose, essentially, and it can have problems that are misdiagnosed as plantar fasciitis a lot. So a lot of times I will do the same kind of technique where I'm using the end of the spoon and just tracking along that tarsal tunnel. You're basically following from the back of the instep towards the medial malleolus. Don't run over the malleolus, that hurts, just like this. If you prefer to come to the end of the table and push like this, that works. A lot of times I work the tarsal tunnel as an extension of those flexor tendons. So I'll be working along the plane of the foot and then just curve it across the tarsal tunnel like that. If you're a puller, not a pusher, you can certainly go the other direction, pulling this direction towards you. Right? That works just fine.
That looks nice.
Whichever one you prefer. A lot of times I like to get that extension of the toe, just like we did with the fingers. So I'm gently extending the big toe and tracking along its tendon. Sounds like a knock.
It does,
but
every time. Like,
just working along each one at a time is fair game, and as many or as little strokes as you need, right? The heel is often very commonly involved in plantar fasciitis, especially right where the plantar fascia grabs that anterior aspect. And you can get in there with the spoon and give a lot of pressure on most people. And it's so much easier on your hands than using your thumb.
I do understand. She's like, oh.
If you prefer to sit down and do that, you can. If you prefer to come to this side and work off of the calcaneus, that works just fine too. It really is what fits your hand and body and the one on the table the best. And everybody is so different. I do it every way. I may have somebody who has a really, really wide heel and it just feels better on them and me toward this way. I may have somebody with a really, really narrow tarsal tunnel and I'm actually using the back end to work this. You just have to fit it to the person. The one other thing that I will say about working on the foot is don't be afraid to treat the actual calcaneal tendon. Body workers, we tend to avoid it. We work on the gastroc and the muscles, we skip the ankle altogether, and we work on the foot. The calcaneal tendon is involved in a lot of plantar fasciitis. In fact, a lot of plantar fasciitis isn't inflammation of the plantar fascia, it's referred pain from trigger points in the medial gastroc. If the muscle belly is tight, the tendon is tight. So a lot of times I will lift the leg up and put it in a slight stretch, and I will run the edge of the spoon right down that calcaneal tendon, or Achilles tendon, if you prefer the... Yeah, it doesn't take a lot of pressure on the tendon, for sure. And it will feel and sound, if you listen.
Oh, wow.
It will sound a little strange. If you have issues, this will be amazing for you. I actually have a injury where I had calcaneal tendonitis, and it was so bad it pulled the periosteum off the bone and developed new bone growth. So one of my calcaneuses has a much bigger tubercle now than it used to, and then the other one. This would have been a great thing to do. I was out in the bush and didn't have a spoon, so I didn't get to do it. I had a 20-mile hike back, so it was no fun. But, yeah. Waterproof boots don't do you any good when you forget your waterproof pants. Then the boots just fill up and carry water while you're walking in rainstorms.
Would you do left side of the leg or just one?
For plantar fasciitis, either or.
In general.
In general, I treat both sides because it just feels better to be balanced. If somebody just has really bad issues with one foot, I may skip the other one. I have some patients who come in for acupuncture, and I will do some Gua Sha as well, so I'll needle all these muscles that are involved, the stirrup, the peroneals and tibialis are the stirrup that come under the instep here. So I'll needle both of those, I'll needle gastroc, and then I'll come down and Gua Sha the foot at the end. And if that's the case, often it's just one foot. But if somebody is having pain in both feet, which isn't uncommon because they'll have plantar fasciitis develop in this one, it hurts to walk on it, so they favor it and they walk funky on the other one, then the other one starts hurting, then you treat both. Simple, same technique. Try it out here on the tendon, the heel, and the foot, and then you'll be good to go.